In this video, I'm going to show you two of my favorite neck strengthening exercises because one of our most popular videos is a discussion on why having strong neck muscles is so important and why it's so vastly overlooked. Stay tuned. My name is Dr. Nick from Preferred Physical Therapy, where we help people 40 plus stay active and independent, live free from painkillers, and avoid surgery. This video is perfect for people who are struggling with neck pain and even starting to notice limitation in their neck movement. So if they're getting stiffer and stiffer in their neck movement, oftentimes there's a component of strength, meaning that we, like all of our muscles, get weaker and weaker over time. Many of us don't go to the gym thinking about doing exercises for our neck, and in particular, movements of the neck. And so part of the restriction isn't just that our neck is getting stiffer, but it's also because our neck is getting weaker. And so today I'm going to show you two of my favorite neck strengthening exercises to help you overcome that stiffness and live a healthier, happier life. All right, this first exercise is a variation of one that's commonly done to help with our neck flexors. What we're doing is we're putting it in a position where we're going to now use gravity to work with us to do all of the extensors of our backside. So anytime we want to look up, so getting our head to go up to get a last drink of water or look up, or if we're sitting forward and we need to look up, anything that has to do with extension in our neck, which is looking up, we're going to work an exercise to strengthen those muscles. And what's overlooked is how much incorporation in our thoracic spine, neck health, mobility, and strength have to do. So we're going to pay attention to the thoracic spine. So in this exercise, Colton's going to be laying on his stomach. There's no equipment necessary. What he's going to do first, he's going to push his fingertips down, and then he's going to bring his shoulder blades back. So it's almost like you want to reach your fingertips towards your ankles and then squeeze your shoulder blades back. And then he's going to bring his chin and neck up off the table. So it's going to be a little bit of a squeeze or a tuck through here, and he's going to hold. Now I want him to belly breathe 3 times. Inhale, exhale, and a belly breath is one where you push your belly into the table while you hold all these contractions, shoulder blades back and down, and then head and neck is lifted off the table and then tucking his chin. So he's staying long. 3 belly breaths and relax. We're going to repeat that 10 times. Fingertips down, shoulder blades squeezed together, head comes up off. So we see all this gap here underneath his shoulder blades and his chest. His chin is coming back and down versus a lot of times we see folks do this wrong and they'll come up this way. Not that it's a bad exercise, it's just not the intention that we're looking for. And so we're looking to get really long through his suboccipitals, his paraspinals in his neck, and then work all through here. We're gonna do 3 belly breaths 10 times. A belly breath is anytime you push your belly into the table, and then exhale while you hold all the contractions here in your upper trunk, neck, and shoulders. So this next exercise is gonna be for rotation. So if you're having a hard time looking over your shoulder in a blind spot, or just turning your head, look behind you, this is gonna be the next exercise. The only piece of equipment you need is a hand towel. So it doesn't need to be much. Any kind of beach towel, hand towel, bath towel, any of that will work just fine. It's going to drape across your shoulders. Now you notice Colton's arms are crossed over in front. The one underneath is just to hold on, just to anchor. The one over top, he's going to lift up. This is going to come across the cheekbone, so stay off the jaw and come across the cheekbone. So he's going to rotate his head into the towel and hold 5 seconds. At the end of 5 seconds, he can relax, and then we're going to repeat that 10 times. So what we're working on is his end range rotation. He's doing it going back to the left. So in this case, he's trying to rotate his head back to the left, even though his arm here is holding it. It's an isometric hold at end range to work not only on mobility, but also strength. Again, these simple, easy movements are often overlooked anytime we're doing a strengthening program for people with neck pain, because it's just something that we don't think about needing to strengthen, even though all muscles of our body are in decline, especially when we have pain and stiffness from arthritis, from herniated discs. Anytime we got a kink in our neck, we wake up on the wrong side of the bed, we have a kink in like a pinched nerve in our neck. These are all exercises that'll be helpful not only for the mobility, but also the reconditioning of the muscles that have gotten weaker over time, contributing to a lot of that pain. So now we have to remember how to switch sides, and this is where a lot of folks will get confused because we have to switch our hands first. So what we're gonna do is let go of the strap. There we go, the towel. He's gonna bring his underneath hand over top. Now his left arm is gonna come over top. Again, the towel stays high up on the cheekbone, off of the jawbone. We don't wanna be pulling the jaw, it's up on the cheekbone. And as he pulls, gets as far as he can. He's gonna then want to try and turn his head back to the right into rotation, but he's gonna hold with the towel. So he's not gonna allow himself to go anywhere, but he's gonna push into it and hold 5 seconds, repeating 10 times. This is called an isometric hold. So those 2 exercises are great exercises to help with strengthening the neck. And remember, neck strength is so important. If you're not sure why, go back to the video. There will be a link to the video that Colton did talking all about why neck strength is so important. These are 2 exercises to help with mobility and strength of the neck to ensure that you can keep it as mobile as possible for as long as possible to reduce headaches, combat against arthritis, and even the occasional pinched nerve in the neck causing a kink where it's now hard to move and difficult to get around. If you're looking to avoid surgery, painkillers, and live an active and independent life as long as possible, take a look at the rest of our videos where we give out tons of free advice and exercises where you can find more health tip videos.